Oh, our new IP. Hey, what are you up to? CVC rounds?
Indwelling urinary catheters.
I see. Well, if you need any help, just let me know.
Thank you. Actually, I do. It's not that I don't know I do, it's just I don't have much clinical experience yet, and any opportunity to learn more is greatly appreciated.
I got you. Worry not, Lisa. Let's dive into the world of indwelling urinary catheters. So, first things first, what is an indwelling urinary catheter?
It's a tube in the bladder.
Yeah, you could say that. Generally, when we talk about indwelling urinary catheters, in healthcare, we mean indwelling urethral catheters. They're catheters that are inserted through the urethra into the bladder, and the tip stays inside the bladder. These are referred to as Foley catheters. But remember, there are a lot of other types of urinary catheters out there. For example, these are not considered indwelling urethral catheters. We've got soft and flexible external catheters for women and condom catheters for men. The benefits of these catheters are that they are not actually inside the body. They are collecting urine externally. This greatly reduces the risk of catheter-associated urinary tract infections. They're often used if incontinence is a major issue threatening skin integrity. For example, if there is an adjacent sacral wound. However, they may not suffice in cases of urinary blockage or a neurogenic bladder, where the bladder struggles to empty naturally. With a neurogenic bladder, often the urine must be physically drained with the catheter inside the bladder. Rarely, urine may need to be drained directly from the kidneys. So, here are a few other catheter options you might see, and some are placed as part of a procedure rather than inserted by clinicians at the bedside. Suprapubic catheters involve a flexible tube inserted through an incision in the abdomen, with the tip ending in the bladder. There is a decreased risk of infection with these suprapubic catheters compared to indwelling urethral catheters. Neurogenic bladder issues are also sometimes managed with intermittent self-catheterization, which is when a patient or caregiver intermittently slides a thin, straight catheter through the urethra and into the bladder to empty urine as needed. So there's no need for a chronically indwelling urinary catheter. Lastly, there is a nephrostomy tube, which is placed through an opening in the skin on the back and drains urine directly from the kidney. They are needed when there is a blockage or compression at some point along the urinary tract. For example, if a tumor is compressing a ureter. In these cases, the urine may need to be drained directly from the kidney where it is produced.
Are the suprapubic catheters and nephrostomies considered indwelling?
Technically they are because they are inside the body, but not through the urethra. However, in general, when people are talking about an indwelling urinary catheter, they mean the Foley.
That's good to know. Thanks.
All right, so can you tell me why we need catheters?
Indications are key. You need the catheter when a patient can't voluntarily pass urine, if they, for example, have bladder outlet obstruction. Or sometimes for critically ill patients, they need an accurate measurement of the urine output. Other indications are long surgical procedures or patients receiving large volume infusions during surgery. Ideally, though, those catheters are removed as soon as possible post-op.
Correct. Also, open sacral or perineal wound healing, urologic surgeries, immobilized patients, or end-of-life comfort care. All these catheters have a mission.
Got it. And what are the no-nos?
Good point. The big one is do not use a catheter instead of providing proper care to patients with incontinence.
Not a substitute for proper care.
You'd be surprised, but it happens. Avoid keeping it in for too long after or during surgery without appropriate indications. Don't use catheters as a means of obtaining urine for a culture when the patient can do it on their own. It's your task to ensure things like that don't happen.
I got it. Thank you.
Lastly, what's the golden rule?
Don't take urine from the drainage bag. Always obtain a fresh sample.
Yes. It's a mistake we see that can cause confusion for the clinician trying to interpret the results of a poorly collected culture, and it can lead to the overuse of antibiotics.
I have a few more golden rules, actually.
Really? I love it. Let's hear it.
Never allow the drainage bag of a urinary catheter to sit above the level of the bladder. It allows for turbid urine backflow into the bladder and increases the risk of developing a UTI.
That's right. That would be gross.
Keep the tubing from being kinked or looped. You want the urine free-flowing straight out with gravity into the bag as much as possible.
That's right, slow flow is a no-go. It also increases the risk of a UTI.
Lastly, always perform hand hygiene before and after manipulating a urinary catheter.
It's like you're in my brain.
Okay, thanks for reviewing with me.
Happy to help. All right, what's next?
Well, I guess I'm ready to go do the rounds.
Great. Remember, if you ever need anything, you can always reach out to me or any other team member. Helping our patients heal is a team effort.
Thank you. I really appreciate that.